Okay, so let's talk a little bit about the difference between a true cyst and a pseudocyst. Firstly, true cyst, maybe the most fundamental difference is the wall of the cyst. The wall of the true cyst is a real wall because it's true. It contains epithel. Now, it's very important because if you have something with epithel, you may undergo, for example, malignant transformation. So, true cyst is a cavity that has something in it. You can see that it may be, for example, serous, maybe fluid, maybe gas, but the wall is a real wall with epithelial lining. This is a true cyst. For example, mucinous cyst in the pancreas, ovarian follicular cyst, brachial cleft cyst. Now, it may go malignant transformation in some cases, but not must undergo malignant transformation. But this is one of the main problems of true cyst. Comparing to pseudocyst, when I say pseudo, mainly the main idea is the wall. Pseudocyst does not have a true epithelial lining. You can see the content, blood, fluid, necrotic material, and you can see the types. For example, pseudocyst after pancreatitis, brain pseudocyst, post-hemorrhagic. So you can see that pseudocyst comes from inflammatory processes, or for example trauma, or for example inflammatory because it's after pancreatitis, for example, and trauma because you see post-hemorrhagic pseudocyst. So this is the main idea. You can see true versus pseudocyst, and now you can see the problems because in origin true cysts are usually congenital or developmental. They may be neoplastic, for example, the mucinous pseudocyst in the pancreas. And you can see the management, it depends on the origin. If it's mucinous cystadenoma of the pancreas, we need to resect it. You can see that also in imaging we can see this because true cyst has a wall and we can use it. There will be septations. Now, pseudocyst has irregular wall without epithelial histology, so you can see it in, for example, pathology. Because what surrounds the pseudocyst is some fibrosis, for example, or some granulation tissues or something like this. Okay, so this is to sum this or it all up. True cyst, it's quite plastic, congenital or developmental, and risk of malignancy may be. In pseudocyst, something like trauma, inflammation, usually there is no cancer risk because there is no epithel, the wall is not epithel. And the treatment is based on symptoms because it's usually benign, but if it causes, for example, mass effect, we need to treat it. So this is the end of pseudocyst versus true cyst. Or maybe let's see some images from the web of the two and sum it with a table you wanted to give me. So let's see, let's start with looking on some images. Okay, so this is just an image of not very good, not very good. Okay, the image is not good. Okay, this is quite a very large table, so we won't go around it. Maybe just again, image includes in true cyst thin, smooth wall, septations, mural nodule. Mural nodule is like you have a nodule in the periphery of the lesion attached to the wall. This is the mural nodule. And in pseudocyst is quite irregular wall, which is thick, and again fibrous granulation tissue only. This is what the wall consists of. Okay, so this is a summary about true cyst versus pseudocyst. Thank you very much, and that's it. And thanks for ChatGPT to summarize the material for me.